In today's video, we are talking, should a federal retiree take Medicare in retirement? Coming up next. Hey, my name is Mel Stubbs. I'm here on behalf of Retirement Benefits Institute to talk to you about your federal retirement and should you take Medicare along with your federal health care in retirement. So let's talk about your federal health care and how it acts in retirement. Not a lot changes as you transition into retirement. The government still pays 72% of the premium, which is really good. You still have the same plan that you have when you retire. Every open enrollment, you get to pick the plan that you want. All of those type things stay the same. If you have an 80-20 split where the government pays 80 and you only pay 20% of cost, all of that stays the same. The one difference is when you're working, you get to write off your premium. Your premium is tax deductible while you are working, but when you retire, it is no longer tax deductible. That's the big change, but everything else pretty much stays the same. So how does Medicare work in retirement? Part A is already prepaid. While you are an employee, you have paid for it, so you will get Part A, and that covers hospitals. What we're going to talk about today is Part B. Part B covers doctors. How does that act in retirement? The first thing we need to go over is, when does it start? If you retire prior to the age of 65, then there are 7 months around your 65th birthday that you can sign up. And that's 3 months before your birthday and 3 months after your birthday, plus your birthday month. So you have a 7-month window to sign up around your 65th birthday. If you are still working past your 65th birthday, then whenever you retire, there is an 8-month window that you can sign up. You will have to contact HR and get a form proving that you've had health care coverage, but you can sign up later as long as you are still working. There is a 10% penalty if you sign up late every 12 months that you're late. So we can look here at what the costs are. You can see the costs right now in 2020 are about $144.60 for most people. That cost would go up by 10% for every 12-month period that you don't sign up. Generally speaking, if you're going to sign up, you would sign up on time. And we're going to talk about later that if you don't choose to sign up, then you probably just don't ever want to sign up to avoid this penalty. Now, when we say that for most people it costs $144, let's look at this chart to see what the true costs are at every income. As you can see, as your income gets higher, the cost goes from $144 to $202 to $289. Now keep in mind, these are individual costs, so if you are married and both of you are going to get Medicare, both of you will pay these premiums. Now the reason I bring this up is we've done some other videos you might want to check out on Roth conversions and how it makes good tax sense to be switching and converting money from traditional to Roth. Now when you do this, you are artificially making your income higher. And so what you want to watch out for is that once Medicare starts, you don't make it so high that you cause your Medicare premiums to go up. So do keep that in mind as well. Now the average non-federal retiree has to take Medicare because we won't have any other form of health care in retirement. So we have to take Part B, and then we have to sign up for some type of supplement to fill in the gaps of what Medicare has. As a federal retiree, you still have your federal insurance. So number one is you don't have to take Medicare if you don't want to. You can keep your federal and it will act just like it always has acted. But you can sign up for Medicare, and between both of them, you'll have a lot of coverage. So if you have the federal and you have Medicare, between both of them, you won't have many surprises. There'll be little out of pocket. Now there are some disclaimers, and this isn't always the case, but just know when you have double coverage, when you have expensive surgeries, between the two of them, most all of the costs are covered and there is very little out of pocket usually. So let's talk about the pros and cons of either signing up for Medicare or not signing up for Medicare. Now the first pro to signing up for Medicare is it is maximum coverage. Now Medicare becomes first position, so they'll be in first place and your federal becomes secondary. But between the two of them, most all of the expenses are covered. Do keep in mind that though it is maximum coverage and most everything is covered under that, you do have the extra premiums of the federal health care plus your Medicare, and if you're married, a second Medicare. So there are more premiums. If we had to make a broad statement of who typically signs up for the federal health care and Medicare, it would be the conservative-minded investor, somebody who does not like a lot of risk. They would rather go ahead and pay the extra premiums to just have the peace of mind of knowing I'm not going to have any surprises of large copays. So let's talk about why people don't want to sign up for Medicare. And these are people that have the federal, they like the federal, it has been sufficient in the past, and they deem it's going to be sufficient in the future. They would rather save money and not make the extra Medicare premiums in hopes that they don't have large out-of-pockets with medical expenses, and they will end up better off in the end. Now, typically this may be the more aggressive investor who is willing to take some risk to get a reward. Let's look at this slide to see how much money can someone save if they choose not to do it. So in this first slide, you can see here that the average Medicare monthly cost is $144.60. Now in this example, we are not factoring in any kind of inflation. So we're saying it's going to cost $144 for the next 20 years. We know this will not be the case as it will get more expensive every year. But for simplicity's sakes, we'll just keep the price the same. So now the annual cost you can see here is actually $1,735 for one person to sign up for Medicare per year. So now look at this last slide. The cost over 20 years is $34,000. Now when you factor in the inflation that will be there, the number would actually be higher than that. So a person that is a more aggressive investor looks at this and says, I can save $34,000 by not signing up for Medicare, in the hopes that his copays and his out-of-pockets will be less than that. Will they be right? Well, that's the thing, is nobody knows. That's why I say a conservative investor goes ahead and pays the premiums, because they don't want the unknown of what their out-of-pockets may be. An aggressive person may be willing to save this much money in hopes that they don't have to pay it out. The other big reason why people choose not to sign up for Medicare is, like I said before, Medicare becomes first position and your federal health care becomes secondary. There are some doctors out there that choose not to take Medicare patients. Most of the time, doctors don't get to make as much money off Medicare patients as they do non-Medicare patients. If a doctor had 100% Medicare patients, they would not make money and would have to go out of business. As doctors get enough patients on their own, they can refuse patients, and a lot of times they will refuse Medicare patients. So if it's very important to you to be able to choose your doctor, no matter who it is, then going on Medicare may limit that. That's one of the reasons why people choose not to go on Medicare. Now, the big drawback of choosing not to go on Medicare is you are subject to whatever out-of-pockets that you have to pay based on your federal insurance. Now, granted, you've had to do that your whole career, but in retirement, potentially health issues may be more, and there may be more out-of-pocket needed. And if you don't choose Medicare, then you are on the hook to pay whatever it is that you're supposed to pay with copays and out-of-pockets with the federal health care. Now, as you search the internet, most of the generic financial advice that you receive will pretty much assume that you have to sign up for Medicare. And for the average person out there, that is true. The federal employee has some options. You have great health care that you get to take into retirement and that the government still pays a large portion of. You've had it your whole career. It may be good enough just like it is to keep in retirement. So you have some choices that the average person doesn't have. There is value working with someone that understands your federal benefits. So reach out to Retire Benefits Institute by jumping over to their website, scroll down to the bottom, and you see there are 3 green boxes. These are reports that you can get that will help you in your planning. The first one is you can get a report that will show you your bring home pay in retirement, shows you what your survivor benefit costs will be, it'll show you what your estimated health care cost will be, and you can talk over all of this information with someone and ask them about Medicare and go over that information with them as well. That's the first package. Now the second package, you get that report, you get to go over it with somebody, ask them all the questions that you want, but you also get a year's login access where you can access a lot of training on all the different facets of the federal government and the retirement system. There's a good bit of information on Medicare and FEHB that you can look through to help in your decision-making process. That's the second package. Now the third package is for people that are getting ready to retire really soon. You can get the report, get your numbers, get all your questions answered, but you also can get somebody to help you fill out the retirement paperwork. The paperwork needs to be right when you're dealing with a big bureaucracy, and if you make the slightest mistake, it's going to be a headache to fix. So if your HR department is in Timbuktu and you don't have anybody that can really help you with this, this is a valuable service. So check out one of those 3 options. Check out more information at retireinstitute.com. And until next time, thanks.